Alright, single anteriors. Just finish it. Okay. And it's like that. A little bit chin down. Then you need a shadow. That's good. Other side. That's very good. Yep. That was good. Okay, this is a single crown to match with the that's good, right?
Mm-hmm.
Alright. That's nice. Okay. Opacity is good, medial contour is good, incisor length is good. Can you take the bite? Thank you. Awesome, thank you. And people can see. And then we can put the halo outside here. And then here's the translucency too. Alright, that's my mapping. Alright, hold on. Alright, this is the natural fluorescency light. So we finish it. The wall. You bite. See? Okay, it's a little bit down. Now as you can get. Make sense? You love it?
I love it. It's the best. I'm so happy. It's the fifth
Thank
time
you.
I'm
Oh,
trying.
sorry.
It's the fifth time.
First time she came from the Mexico, so I don't want to get the dehydration. I already see the dehydration is crack line I see. That meaning she has the dehydration right now. But when a tooth is back, that's a light, yeah. So that's back. Then you cannot see much dehydration. All right. So can you move to different direction? Then you can see the better side view, right? And then move to the other side. Tissue adaptations between the tooth. Right, this is the tooth, and here is the other crowns. Actually, 3/4 veneers, right? Just love it, right? So you can go a little bit more high. Yes. Now, as we match the other side, lateral. So I really like the incisor embrasure between tooth. Love it. And canine, look at this canine shape. That's good. And then we made this. This is final beauty. Can you bite? Thank you. All right. Love tissue adaptation. Incredible, right? And the medium tooth shape and contour. This good translucency and the amount of a texture. Now is the signature line. Great. Right, it's another single one, so kind of busy, hectic. So we finish it. Chin down. Yeah, that's good. Beautiful. So I put the white classification from the Gingival to all the way incisor. And this is fast dehydrated, like I said. But here is this pretty good colors of content of incisor mount. Especially I put the incisor 1/3. I'm sorry, 1/3. I put the kind of like I show them orange types of the halo. So that's why I finish it. Hold on. All right, and then can you put some of your saliva? Open it. Thank you. That one is what it looked like. That's what we're looking for.
Awesome.
Yeah, good. All right, thank you very much. Here is this final history, which is we took it out, the custom abutment from the patient's mouth. Nice, that's good. So we put the abutment and screw in. Before we do that, so we put the tissue, which is the important size of the facial contour, like that. So we're trying to make deepen it, right? But compared to CJ, it's too long. But we added pink, and finish the cases. Okay. Now it's ready to go in the patient's mouth, which is the videotapes. Great. So out-of-state doctors and our laboratories communicate together between the color selection, which is really tough. It's not really clear, but I see here's a little bit gray color, and also I noticed that here's a little bit whitish color here, and then here's the yellow mamelon down there. Okay, so here's the work, what I did, what we did. It's almost done. It looks good. Okay, so I like the middle colors, which is sort of gray. I want to, or I can put this little bit white. So I want a little bit more whitish looking, which is patient has. Not like chubby, but I can get the better dehydration looking, and then this is good. It's pretty, looks like simple, but it's not simple. Okay, so now we're going to bake after vibrations. We'll see. Okay. Alright, so we matching the colors, single anteriors is really tough, and then we finally finish it. And we put a little pink porcelain all the way underneath. Okay, could you bite down gently? Thank you. That's good. Great color. Great CJ. How's it comfortable? You think heating all the way back?
Oh, it's good.
It's good. All right. Just move it. Move this. Beautiful. Okay. Open up. Thank you. So this is we can call the one single implant case. Thank you. Okay. So this is final. We put the external stain with the spectrum colors. Beautiful. And see. So we make the diastema. Chin down. Thank you. Okay, it's hard. It's a little pinching. Can you check the bite gently? That's good. Chin down. All right. That's the lifelike restoration. See? I know people keep saying the long, but it's not. I have to push it, then you can get the same level. I don't know why I keep right. It's good, right?
Mm-hmm.
Awesome. I'm going to show him. Then good to go. Open. Alright, it's this nice gentleman here that I love beer. And then we finish it. Can you chin down a little bit? Chin down. Thank you. So this is final work. Can you touch the more mirror and you see the better color? Oh, not too bright. Move it. Chin down.
Where we had it.
Sorry. One more time. Video is not. Continue. I put the little brown all the way, but like I said, I don't need this area. Using the glazing, I put the SP16, create the translucency. Okay, and then I created medial and distal. And not only that, I create the halo like that. Color is better. Yes. Okay. I put a little nicotine tint. That's it. All right. Another tough case today is the 6-unit PFM bridge, which is porcelain butt margin. We made it. 4 abutments, nice ladies here. We fit it, and we made a great translucency, awesome fitting, awesome texture. Can you bite? Thank you. Yeah, that was great. Move it. All right, and take it out. I don't know, it's too shiny, right? Too reflection. Better. turns face that way. Good. We match the size, and then unfortunately, tooth is too long because it's the bone loss. We're trying to decrease it as much as possible, and then we finish it. Just match it perfectly. Beautifully done. Nice job. Thank you. Single analysis, which is the just show you the how to apply with the spectrum stain, which is like I said, here is the dark, and between the tooth, and it has a little bit blue, dark blue, and then between here it has a halo. Okay, and between those is color slightly difference. Here's a really composite patching it. I don't have to follow exactly here, okay, because this is new shoes, this is old shoes. Anyway, we finished a single unit and send it to all the way California. So here, try that one. Okay, cool. All right, this is the illustrations about the tooth color, especially here. It's crack line. In between crack line has a little sand color and a little bluish color here, but however halo here is lighter than this. Okay, I'm going to mimic a little bit, not too much. So here I use the spectrum color, which is SP2, like that. Okay, then I can put the in between the teeth. Not only that, I like the 13 between 12 here, so create a little bit. Like this. Can you see? Okay. Now, top of that I applied with a creamy color. Can you see? Okay. That was another trick in to me is a makeup. Right? And then I continue to do this is subtle. Okay. And then also I use a little between the tooth. Now this is better. Make sense? So this is using the spectrum color with after layer, and then we just maximize it color for here. This is maximize it. Okay, good. Alright, this is the veneers. We're trying to mimic with the color, which is the pre-op colors. I see the slightly the grayish looking, which is using the 12 and then 13, the slightly grayish surface, and also I got the little bit frost looking in between, like that. Okay, and also I have the slightly orange tone compared to this, and also they do patient has the little bit grayish color in between interproximal area, very subtle. Okay, this is a glazing technique, so I can get. So I like the little brightness. This crack line too. So that's why Concord Spectrum is very exciting about this. Let's make it. Alright, another shade matching is pretty tough from color evaluation because it's a high reflection, so I don't get it. But I can tell a little bit about grayish compared to here, little crack line. So we use the spectrum layer color compared to 3M1. Okay, so we're using the all spectrum materials, so trying to match it. then especially I use the 13 and then 11 and 8. That was good. It's light, so I can do either one's light or dark, thick or light. Good. Right, this is it's my secret. Some reason we make these restorations too bright. I don't know, just maybe doctor just prescribe it. Shade numbers, so we match the B1, but it's completely different. So GC made it great color, which is light pink, right? This, and then slightly it's orange here. Okay, so which is 9 and 10. It's a new product came out. So we finish it with this, and then I match it a little pinkish, the gray, and then halo with a 10 color. So we finish it a little brighter than that one. This is more darker, this is a little bit lighter, this is too light, this is canine color, so that's more natural, so that's why we finish it 2 crowns. And also we do have another veneers, like this. Can you come here? Okay, this is it. We can fire it. So I use the spectrum stain. But this is the first start. Hold on 1 second. Lateral, buildup, with the Zirconia abutment. So I put the dentin compared to Jason T's slightly under, and then I utilize a little bit more the TMO4 5 between here. Just to create it the maximum enamel. And also I put the mamelon because here is a lot of a mamelon, and also I put the CT, cervical translucency, trying to make the little bulk out. TN. So you can use the linger. Slightly lack of room. Yes. I don't have to cover all the way because it's not much room. Also, created white effect, and here's the enamel 59. That one is my almost final first layer build up. Then I have to cut it between the proximal area, and then I file it. Okay?
Subscribe to Luke Kahn's Patreon for ongoing valuable information for dentists from a lab side perspective. For just $25 a month, you will receive live training online with Luke Kahng, as well as live chats, Q&A sessions, and ongoing dialogue exclusively via his Patreon. Subscribe today